Hey, Dr. C here. Hope you're having a better day than I am. It's getting cold out there now, so we need to take care of that. Us old New Englanders, you know, we have our way of taking care of all that. So today I'm going to talk about fatigue. And I'm also going to especially talk about fatigue in the elderly. And I'm going to talk about fatigue during the age of COVID, because that is obviously a major symptom of COVID, and we need to discuss that a little bit. So, first of all, I always start with a definition. But with all of our quotes, wonderful definitions out there, end quotes, the definition that you find for fatigue is a state of tiredness that does not resolve with rest or sleep. Now, as an elder person myself, I can experience a lot of these tired feelings during the day, and they don't necessarily go away with sleep. At least that's my experience so far. So I'll have a little bit of an argument about the definition, but certainly fatigue implies a more serious type of tiredness, a tiredness that's worse, the worst kind of tiredness, fatigue. And so let's discuss a little bit about that extreme tiredness. Well, it could be a physical tiredness, well, with your muscles. Maybe you exercise too much, or maybe you don't exercise at all. Two extremes, they can both result in fatigue. So that's a physical or muscle type of tiredness. You could also have a mental fatigue as well. Most common reason for that is depression. Now, I've said many times on this show that depression is an underlying cause of a lot of these external symptoms that we see. It's a very nasty thing, depression. And I know because I go through it every now and then myself, and I recognize, you know, that's depression. And you try to combat it the best you can. So a mental fatigue is also quite common. That's the thing that really gets to people with chronic pain or a chronic disease of sorts as well. You get the physical thing at first, and then as time goes on with the chronic pain or the chronic illness, now the mental fatigue really works in. And so that is a major issue as well. So those are the two types. It can be acute, that is something that suddenly happens and hopefully resolves quickly. It can be prolonged. By prolonged, I mean it lasts more than a month. That's the definition that we accept, a prolonged fatigue. And then we have a chronic fatigue. That's a fatigue that goes on for at least 6 months. So all those different types of fatigue as well. What causes fatigue? How does it happen? Well, first of all, I mentioned physical. You're exercising too much or not at all. You may get it as a result of insomnia, lack of sleep. If you don't sleep, it really begins to wear on you. You begin to get a mental fatigue that then may translate later into a physical fatigue as well. And so grief is a very common cause of this fatigue as well. Say you lost a loved one. Say something happens in the family that is a major issue for you, and you never deal with your grief. And so I'm a big believer, incidentally, with grief. I'm a believer in crying. Nothing wrong with shedding those tears. There's tears of joy, but there's also tears of grief. And they both can be very healing as well. So, okay, let's not get off the topic here. So, lifestyle does have a lot to do with the causes of fatigue. It may be that because of it, you turn to meds. How can I get more energy? So you go and buy supplements, go get your marijuana, get whatever you want to get. But they have an effect as well. And the effect in the short term may be good, long term, maybe not. Some just turn to alcohol. Forget about it. Drink your worries away. Okay? Some will try to get more energy by drinking a heck of a lot of caffeine. Remember, you can get caffeine in many different ways. You can get coffee. You can get your Red Bull. You can get chocolate. You can get cola drinks. Loads of different ways of getting your caffeine in to excess. And some people will eat their way. Some people will starve their way. So either way, it's not good for fatigue in the long run. So lifestyle has a lot to do with the causes of fatigue. There are some physical reasons why you may get fatigued. One would be an anemia, not enough red blood cells bringing oxygen to the body, to the cells in the body. That can cause a major fatigue. You can have excessive or underactive thyroid. That needs to be checked. That thyroid function study needs to be checked, just like a blood count needs to be checked. As I mentioned, insomnia, I could put that in the physical part as well. Anorexia, the lack of eating, or just the opposite, obesity as well. Okay. There are many different diseases, chronic diseases that lead to fatigue. Cancer, for example, that's a chronic disease. You may not have an absolute cure. So that is constantly eating away mentally at your body. Diabetes, you may have very brittle diabetes, never really totally under control. So that wears on you as well. Anytime you have chronic liver or kidney disease, they can't be cured. So that weighs on you as well. You may wind up with chronic heart disease, congestive heart failure, chronic irregular heart. Again, always worried that it's going to return. So all those are all reasons why you would get a chronic physical problem. And those are the things that we look at if somebody comes in with a complaint of fatigue. And then, of course, there's the mental health aspect as well. Depression, I mentioned, that's number one. Number one, depression. But there are people who have significant anxiety disorder. There are people who have significant seasonal affective disorder that also can cause fatigue as well. Okay, so those are the major causes of that. I want to talk for a moment now about fatigue in the elderly. What are the possible causes of fatigue in the elderly? Well, number one, your age. I never had fatigue, for God's sakes, when I was younger. I do now. I don't. It's an acute thing. Get over it fast. But I get pooped. I can't do the work I used to do. So age has a big deal with the elderly. But the problem in the elderly is then compounded by the fact that when you are fatigued, you may not be totally aware of all of your environment. That leads to falls. You may also have some weakness in your muscles, which puts you off balance, leads to a fall. A lot of falls in the elderly. That's the reason I do all those exercise programs for them, to try to improve that balance, As we get older, we're not as alert as we used to be. No question about it. You really have to concentrate to focus. And that's what I do. When I'm driving, I am focused on that driving. I don't care what else is bothering me before I got in the car. I am focused on that driving while I'm in there. That becomes a little more difficult as you get older, of course. Your coordination may not be what it was either. By coordination, I mean getting your whole body to act as a unit. So if you do one thing with your arms, you may have to do something different with your legs. You have to coordinate all of the different parts of your body. That becomes more difficult as you get older as well. So let's say that I'm a senior now, and let's say I go into the doctor. What's he going to do? Well, he'll do his physical examination. Obviously, he's going to check your thyroid. Obviously, he's going to check other endocrine sources for the fatigue. He will check your blood sugar as well. Because remember, I mentioned the diabetes. So he's got to rule out a lot of those medical causes because they're treatable. They can take care of that fatigue for you. So basically, once he goes through that diagnostic workup, he's going to give you a treatment plan. So I always emphasize that treatment for the seniors. Exercise, 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 all the body. You want to try to improve balance and coordination. Those are the things you need. Also with the elderly, I make sure they have enough fluids. It's amazing how many elderly do not drink enough water. They don't drink enough. So they're right on that borderline of being dehydrated. Now they're functioning okay, but it doesn't take much, just one day. And they can drop that amount of fluid into the dehydration range. Then you get the fatigue along with it. So make sure you get adequate hydration. Now, I don't tell people you got to have 8 glasses or 6 glasses a day. You drink what you have to drink. So for me, that may be 4 glasses a day. If I were exercising and sweating more, maybe I would have to drink more. But you have to maintain a nice balance with your hydration. Make sure you get enough sleep. Make sure that room is dark and quiet and adequate temperature. Remember, 68-degree temperature, perfect for sleep. So you want to maximize all of the little things that you can do to improve your sleep quality. You want to watch your weight. If you're overweight, you need to cut down on those calories and exercise more. Get that weight to a more reasonable level. You want to do something very simple. Rather than 3 meals a day, which we are always told, oh, you got to have 3 meals a day, that's total nonsense. Why do you have to have 3 meals? You may want to have 4, 5 smaller meals spaced out during the course of the day. You do what is the best for you. So that's what you need to do to treat it, especially in the elderly. Now let me deal a little bit with the fatigue that we emphasize with COVID. Now you can get fatigue with any virus. In fact, they call it a post-viral fatigue. And that's a real entity. And a lot of the scientists don't really know the exact cause of post-viral fatigue. There are theories, of course. The first theory is that, well, it's a mitochondrial thing. The virus is in that mitochondria. What the hell is a mitochondria? A mitochondrium, that's the energy, little energy packets that are in all the cells in our body. That's where that ATP is. That's where the energy comes from. It's all packaged in those mitochondria. But that isn't necessarily, it's a theory only, a theory only. Now, they started doing research on this viral thing long before COVID came into existence. They started doing that with mononucleosis because the Barr-Epstein virus, the cause of mononucleosis, causes extreme fatigue. Fortunately, most people with mono are the kids, usually young teenagers, early 20s. That's when the maximum number of mononucleosis patients occur. So they were doing research on that to see if maybe there's a viral connection there with the cells in the body. Well, they tried to, once the viral medication came out, they ran a study too to see if they could put people with this, what's called syndrome, this post-viral fatigue syndrome, put them on an antiviral agent. Did it make a difference? Seemed to with a lot of patients. But it's not clear yet what the actual reason is. What does that virus do to trigger that fatigue? We have not seen the results of that yet. So it still remains a theory, just a theory. So let's, again, talk about the COVID related. One of the major symptoms of COVID-19 is fatigue, extreme fatigue. I know when I had a son who had it, he could hardly get out of bed. He was a young, vigorous. He couldn't hardly get out of bed. And that is one of the major symptoms that people have. And not only do they get that symptom, which usually lasts for 2 to 3 weeks, but then there's people who have long-term COVID. That particular entity, the fatigue part, that's lumped under the brain long-term complications. Now, whether you call it brain fatigue, brain fog, chronic fatigue, whatever the heck you call it, it can go on up to a year if you've had previous infection with COVID. Up to a year, and sometimes even longer. Why? We're not sure yet. We're not sure what causes that or how to adequately treat it. So, obviously, Barr-Epstein virus was the first one they studied. They also now have included herpes simplex, especially the herpes that is related to the varicella, which is the long-term complications of chickenpox, i.e. shingles. You can get chronic fatigue with shingles as well. You can get it with HIV, the other virus. You can also get it fairly significantly with rubella. You can get it with the COVID, as mentioned. But there are other viruses that are known to be associated with fatigue as well. And so that's how you diagnose it. But the problem is, how do you treat it? Well, those who have the long-term COVID, it's very similar. The symptoms are very similar to a thing called chronic fatigue syndrome. Very similar. Non-explained fatigue over 6 months. And there's a big significant problem with trying to maintain your focus. You may have trouble with some recent memory. People worry for a moment, well, maybe I'm getting dementia and all. Well, the symptoms may be similar, but that's not a dementia. Not a dementia. So, also, there may also be some dizziness as well, unexplained joint pains. You may even have some swollen lymph nodes, especially in the neck and armpits. That's especially with the Barr-Epstein virus that you get that type of thing. You may have some difficulty with sleep just on the basis of that chronic viral infection as well. Let me tell you for a moment about this brain fog. Brain fog. What the heck is brain fog? It's a cloudiness of your whole consciousness. It's a lack of mental clarity. You're not as clear, not thinking as crisply or as clearly as you usually do. You have difficulty recalling things. That's why the memory. You have difficulty with focusing. That's why you have that problem as well. You may even be impulsive as a result. That leads, in fact, a lot of people, leads them into a depressive state. And it isn't really their fault because of this viral illness like that. So that is the brain fog, the brain fog. I noticed that for a period of time, when I got in my elder years, I have difficulty myself with multitasking. I used to be able to bang, 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 right down the line without thinking. Now I got to keep a list. I keep a list. Oh boy, I got to do this. I got to do that. Well, sometimes you do what you have to do. But multitasking for me was a difficult problem. And that's without the virus. That's without it. Maybe I should get my thyroid checked. I don't know. Okay. But that's also a common thing. Make sure you get that checked, and your B12. Those are the two things you want to make sure the doctor checks when you get that. I should speak for a moment, too, on a disease that's called narcolepsy. That's a chronic sleep disorder, but that usually occurs at a younger age, say between 10 and 25, right in that age range, usually. At our age, we don't normally see narcolepsy at all, chronic sleep disorder. Because with that particular disorder, that occurs during the daytime hours as well. Overwhelming daytime drowsiness. Sudden attacks at sleep. If I was sitting at this desk and I suddenly fall asleep, you say, what's going on with that guy? Is he having a stroke? What's going on? No, people with the narcolepsy can fall asleep anywhere at any time. Now there's two types of narcolepsy. One is associated with a thing called cataplexy. Now cataplexy is a sudden loss of muscle strength. Sudden loss. So that's the type 1. Type 1 is the narcolepsy with cataplexy. And obviously the type 2, there's no cataplexy. Okay. So those are the two types of the cataplexy. And some people may even have restless legs with it. Some people may have sleep apnea with it as well. Not too many, but there's a significant enough number to make it something to think about. What are the types of things that you notice with narcolepsy? Well, obviously, problems with your sleep, problems especially with the REM sleep, REM, rapid eye movement sleep. We had a talk on sleep. We talked about rapid eye movement sleep. What happens during rapid eye movement? That's when you get your dreams. So what type of dreams might you have when it's abnormal? Well, you may get hallucinations. You may see things that are not there, and they look real. You may hear things. Somebody's playing music. No, there's no music. You may smell something. Somebody's cooking in the kitchen. Nobody's in the kitchen. So these are the types of hallucinations that can occur frequently with cataplexy in narcolepsy. How do we treat narcolepsy? Well, I used to have, back when I first started practice and all, I had people who would come into the office, young people, and they would complain of narcolepsy. Oh, okay, how do you know you got that? Well, they didn't have all these symptoms, obviously, but what they knew is that the treatment back then for narcolepsy, about the only treatment that we had, was using an amphetamine. That's what they were after. Yeah, I remember I had a cousin that had that. He had this, he used this dexamphetamine. That was good stuff. Okay, now I know why you're here. Get out of the office, you know. So that was the only treatment back then. But nowadays, there are some good ones. Provigil is pretty good. That's a non-amphetamine drug, Provigil. It's effective maybe half the time with narcolepsy. And some antidepressants can be used as well. So at least now we have a treatment. At least we have a treatment. I want to talk too about how do you measure fatigue? How do we know if somebody comes into my office, how do you know if they really have significant fatigue? Well, there are a couple of studies that you can do, tests that you can run. One is called a Chalder Fatigue Scale. It's a scale. There's something like 11 items that they have to answer. So you try to make your test nice and short. Takes 5 minutes to run through the yes/no on these tests. 7 of those items have to do with physical, i.e. muscle fatigue. 4 of the items have to do with mental fatigue. And so you just add them all up, and if you achieve a certain score, you would be labeled, basically, as a fatigue patient. Most of the places now use a fatigue scale that came out of Korea, actually. It's a multi-dimensional fatigue inventory, they call it, MFI, multi-dimensional fatigue inventory. And now that has 20 questions. But again, what it does is that it measures both physical and mental signs of fatigue. And again, you look at the score and you can see if you need to treat somebody. Now, how do you treat them? Well, I think I mentioned to you before the things that I do to treat the fatigue. Number one, I would probably put them on omega-3 fatty acids. I would put them on B12. I wouldn't even check it. I just put them on some B12. Because after a month, you'd know if that makes a difference. I would emphasize if they're using any of the seeds, flaxseed seems to be the best one to use. Use a lot of the berries. The berries have anthocyanins, and the berries are very good. Brown rice, not white rice, not processed rice, brown rice is a good thing to take. Chickpeas. Chickpeas are very good to have in your diet. Eggs are good in your diet. Greens are good. Of course, greens have a lot of B12, which is why they're so good. And a lot of the times, the fish is good as well. So I have them use those, get them on an exercise program, a good sleep habit program, and try to get them as active as possible during the course of the day. Okay, I think we've gone through all of the things I wanted to about fatigue. This is Dr. C. I hope you have a nice day.